Hi, let's talk about the pericardium. The pericardium is a sac which surrounds and encompasses the heart. It's formed of two layers, an outer, rough and tumble, fibrous pericardium, which we can see here, and an inner, delicate mesothelial membrane called the serous pericardium. Now, the fibrous pericardium is going to serve as an anchor point for the heart. We're going to see that it encompasses much more than the heart. It comes superiorly to surround many of the great vessels, in particular the ascending aorta and the pulmonary trunk. So we can see this is reflected away. Inferiorly, the fibrous pericardium is fused to the diaphragm, so the heart within the pericardium is going to move with ventilation. The fibrous pericardium is inelastic, and you should feel this and demonstrate it for yourself in the laboratory. It does not stretch. It's going to represent the maximum amount of space that the heart will be able to relax into during diastole. And it's also a physical barrier to infections entering the heart. It's a triple layer of collagen protein, each woven at about 120-degree angle to the other layers. The serous pericardium is deep to the fibrous pericardium, and as a serous membrane, you might think that it has two layers, and you would be correct. There's a parietal layer. The parietal layer lines the wall of the cavity where something is in, and a visceral layer. The visceral layer is upon the heart itself. So that parietal layer adheres directly to the fibrous pericardium. So in this image here, with the pericardium incised and reflected open, everything that we can see here as this shiny surface is going to be the parietal layer of the serous pericardium, sometimes just called the parietal pericardium. Now, the visceral layer of the serous pericardium is also known as the epicardium. It is upon the heart. So if you encounter a heart such as this, the most superficial layer is that of the epicardium. And it is actually a ciliated mesothelial membrane. Deep to the epicardium is going to be the epicardial, sometimes called subepicardial adipose, or fat. It tends to be directly proportional to cardiometabolic risk factors. So the more epicardial fat an individual has, the higher the risk of different diseases such as hypertension, coronary artery disease, insulin resistance, and diabetes, etc. And here we can see some of that epicardial fat. We can also see, and we'll get into this in the next session, some of the vasculature, which is moving through that epicardial fat to serve the heart wall. The space between the parietal and visceral layers of the serous pericardium is the pericardial cavity. And so we can see this here. There's not much room actually in life. The only thing that we really find in that pericardial cavity is about 10, maybe 15 milliliters of ultrafiltrate, which is secreted by the visceral layer of the serous pericardium. Materials can accumulate within the pericardium. So if there's inflammation, so pericarditis, transudate can fill. If there's injury, blood can fill. And that can put pressure on the heart, which would be cardiac tamponade. So this is the pericardium, fibrous and serous layers, and the serous has both a parietal and a visceral layer. Thank you very much for your time.